So as a medical doctor, you're also a patient, and you talked about how relatively recently in your career you just found out about visceral fat and made these changes with the way you look at imaging and report. But let's look at your image here. And this is side by side, one image on top of the other
Yes.
of your abdomen. So I'll have you take us through what you're looking at here. When you say this is somebody else and you're looking at it, how would you describe what you're seeing?
So this is the top image was the first image. Again, my journey started when I met Sean in 2020 and I learned about the strategies. 2020 was a very stressful year for all of us. So I haven't been very successful in 2020 in getting them done because stress is a major problem that prevents burning visceral fat, reversing visceral fat. And that's why he talks about the strategies that are specific for decreasing stress. So I started more in 2022. And again, now I am also a high performance coach. And I believe that changing my mindset was extremely important to obtain success and to sustain success. Because, like before, from 2020 to 2022, in 2020, I was weighing 226 pounds. So from 2020 to 2022, I would start, I would fail, I would get out of track, and I would just not have the commitment, the consistency, and the compassion of getting back on track, right? The mindset that would make me keep moving forward and getting the strategies and understanding that it's an exercise of patience, right? Because if I got to 226 pounds in 50 years, I'm not going to get to reversing visceral fat in a year or 6 months. It's going to take my time for my body to heal itself and burn the visceral fat. So in 2022, I was already like 186 pounds. And you can see in the top image at the level of the belly button, you can see the area there. I don't know, you can see. So on the top, there is this area that separates the fat in the abdominal wall, and that's my belly button. So everything that is white inside the abdominal cavity below the muscles is visceral fat. So as you can see, it's easy to see visceral fat. It's just not reported because doctors have not learned about it.
Let me jump
So
in for a quick second here.
yes,
So this top image here is you, and this
yes,
is after you've already lost a significant amount of weight, correct?
yes. So I don't have my beginning MRI because I don't have my beginning MRI at when I was at 226. And I got to 226 pounds because my husband died from colon cancer and I was just eating my stress, eating my sadness, eating my grief, right? Which is something that it's very important to understand that it's a healing process for life too, a grief journey. So when I met Sean, after I started implementing some of the strategies with a fail and coming back, fail, coming back, fail, coming back process, I got to 186 pounds, and that's the top image. So all the fat that you have, all the white inside the abdominal cavity is visceral fat, and it's a severe amount. So the bottom image is also me. And there are two interesting things that I would like to catch your attention here. First is that the anterior posterior diameter of the belly button, on the top, you can see that it's more of a protuberant abdomen. And on the bottom, you can see that it's more kind of a flat oval abdomen. And that's how you could see your own improvement in visceral fat. When you lay down in your bed or on the floor, if you see a protuberant abdomen, almost like as if you are pregnant, it's because you have lots of visceral fat. If your abdomen, after you start the strategies, goes from protuberant to more oval, flat shaped, it's because you are decreasing your visceral fat. And again, you can see that it's more oval, flat shaped, and the amount of visceral fat has decreased. And also, another thing is that since I am doing my sprinting, since I am doing my daily walking, since I am doing strength training, you can also see that there is improvement in the muscle mass, particularly the oblique muscles. On the left side, you could see it better. You can see that they are more thicker, the oblique muscles of my abdominal wall. And I want to tell the women, or even the men, but specifically the women who believe that it's so hard to build muscles, especially if you are on menopause. I have been in menopause since 2019 because I had a surgery that I needed to remove my ovaries, and it was an abrupt menopause. So I can tell you, it is a myth. You definitely can build muscles. It's commitment, consistency, and compassion to you. If you are less than, and consult your gynecologist, because another myth is that hormonal replacement therapy is prejudicial for your health, is detrimental to your health, which is not. Hormonal replacement therapy, there are lots of new studies showing that depending on when you start after the beginning of menopause, even better if you are in perimenopause, it protects your brain, it protects your memory, it protects your heart, it protects from muscle and bone loss. So again, I'm just advocating for my women community here. So decreasing visceral fat, improvement in muscle mass, and that's the picture that shows my own journey. And right now, I am very happy to say that I am even better than the bottom image, because I lost more weight and my measurements have decreased as well. And I can see that my abdomen is even flatter because, yes, so again, day in, day out, keep doing the strategies, choose your hard. My why, connect to your why. You know, it was very important for me to move from the top one to the bottom one. It was very important for me to understand that my reason for following the strategies wasn't only that I wanted to lose weight, look better, and fit in a smaller pair of pants. This is awesome, and I applaud each one of you who want to look better. But it was also like my grandma had diabetes and she died from complications of diabetes. She had a heart attack and she was also blind with renal problems and all the problems from the neuropathy. She lost like a few toes in her feet. So my why, I didn't want to have diabetes, and my glucose levels were always super high, and my hemoglobin and A1C was always high, and my insulin was 10. So like, yes, it was extremely high too. So that was my first why. My second why, which grounded and anchored me even more in walking and doing the exercise portion that I have never liked very much because I have always been sedentary, was my father. My father was a surgeon and he died in 2021. And he spent his whole life taking care of other people, being sedentary, knowledgeable, smart, like amazing person, with his clients, with us too. But that the point is, I want to say like the doctor life, right? The sedentary life. So he had this extremely sharp brain, but he had an extreme amount of visceral fat too. And when he got hospitalized because he had a femur fracture, he had a CT of his chest, abdomen, and pelvis. And when I looked at his exam, I was in shock. Like my father barely had muscles. All his muscles in his body were like 95% replaced by fat. The extreme sarcopenia. He could barely walk, and that's why he fell and broke his hip. And yes, so he had this huge amount of visceral fat. He looked like as if he was pregnant of an 18-month kid, not even a 9-month pregnancy, you know. And again, I saw his body failing while his brain was so sharp. And that made me realize, man, that's how I'm living my life. You know, I am sedentary. I sit in front of a computer. I have artificial life in front of me all the time. I'm eating all this processed foods, Doritos, Coke Zero, and, pasta and bread, and eating late at night, sleeping really bad, never going outside. And Sean gave me all these strategies, but I didn't have the mindset, the perfect mindset. And then my grandma and my father linked together, anchored in my heart, connected my brain to my heart, and I was able to realize I got to take care of me because I have to choose my heart, and my heart is I don't want to get diabetes. I want to have quality of life with muscles, bones, memory, because they are all connected. Muscles, bone, and memory are all connected. And yes, I don't know how many years I'm going to live. That's not for me to decide on my faith, but I know that how many years I have to live, I want to live them to my best, and I will do my best to live them to my best, Yes.
Okay, coming back to your pictures here.
Yes.
What was the timeline between the two of them? And you've mentioned walking, exercise. I'm assuming really significant dietary changes to have that change that we're seeing here. But talk about what that timeline was and then more specifics on what you did in that period to cause the changes we're seeing.
So the timeline from these two pictures would be around when I really started when I really started implementing the strategies with commitment and consistency and discipline. So the timeline would be around almost 2 years. And again, I was going through a lot of stress due to health issues and professional issues. So there are people so again, it's you are your own comparison, right? So different people improve faster, different people improve slower. I took at least 2 years if I consider right now where I am right now. And I am now at 140 pounds, and my visceral fat is way smaller. But again, I want to go to zero or minimal. But I would say for me, it took 2 years because at least in the first year, I saw very little improvement because I was dealing with a huge amount of stress. So I started implementing the strategies to control the stress, which are mainly the sprinting, the high interval exercise, the sauna, the cryotherapy, the cold plunges, the showers that are cold in the end, and taking good care of my sleep. Now I definitely take good care of my sleep. I use this Aura ring. No, I'm not making propaganda, but it really helped me on taking care of my sleep because I am aware like of how many hours and if it was a restful sleep. And it made a huge difference. It made a huge difference in my energy. And when I felt like, wow, I do feel calmer, so that's when I started losing visceral fat faster, although the strategies were always being implemented. So I definitely tell myself that the mindset strategies make a huge difference in the stress, like going outside, enjoying the sun, looking at the sunset, looking at the sunrise, and having a walk in the sun for 10 minutes with no technology, where you just release everything that is hurting, painful, worrying you, and you have time to be with yourself, and it increases creativity as well. Or mindfulness with the vagus nerve technique, like breathing in, breathing out. Breath work is really amazing. And connecting with the five senses when you are feeling stressed. Everything is important. For you to reduce visceral fat, you have to work in your stress. And I would say all these techniques that reduce stress are extremely positive and extremely like they do work, powerful. So taking care of the sleep. Let's see gratitude. I practice gratitude daily. Hence, in my Instagram, I am Ana Rosa Gratitude. And I've learned gratitude when my husband died because the grief journey is very raw and it hurts you a lot. And I needed to build something that would give me a foundation that I would be able to keep living and building life. And that's when I grounded myself in gratitude. Every time I would feel hurt, I would ask myself, instead of why is this happening to me? Why that had this happened to me? I would ask myself, what can I learn from this? How can I move on using this, And that's when I started being grateful, Yes, grief sucks. Yes, grief hurts, but I wouldn't change. I wouldn't switch. I wouldn't choose not having grief, because having grief made I had my husband, and I have my husband. So I am grateful, and I have my foundation in love. Anyway, I kind of went on a tangent, but the other strategies, but it's a tangent that it's needed to burn visceral fat. So other strategies that work very well, since December 21, I walk daily. I do it like I haven't missed one day. One day, not even when I was sick, not even when I was tired, even if I walk just a little bit here and there, by the end of the day, I get at least 10,000 steps. And what has it become to me? It became my mental health tool, teaching my brain that I am my best partner, my best accountability partner, that I get my back, that I am my friend, that I can trust myself. And then anytime I have something challenging to go through, I know I can do it because I am walking every day. So my walking is my time to connect with me, to connect with friends, to text and say, hey, I miss you, I love you, I'm here for you, and to go outside and enjoy the sun. So walking every day, 10,000 steps plus. If you don't know how much time that would take, in general, for the other people who started walking with me, in 10 minutes, you walk 1,000 steps. So you can plan that throughout your day. If you are a workaholic, like I have the tendency to be, you can schedule in your phone every hour you're going to stop and walk for 5 minutes or 10 outside, enjoy the sun, take a deep breath in, breath out, drink your water. So walking, sprinting. I don't do sprinting very much. I should say that I am guilty on first instance for the sprinting, but I try to do it at least twice a week. I kind of do sprinting more on my bike. I have a stationary bike in my house, and I do the sprinting on the bike. You can do sprinting by normal sprinting on the street or on the grass. You could do sprinting on your bike, stationary bike, on your elliptical. So there are different kinds of technique that you could sprint. So you can check that for whatever feels more comfortable for you, especially in the beginning, because you don't want to hurt yourself. I do fasting. I do prolonged fastings up to 72 hours. I did a couple of 96. It's too hard for me. And I follow what Sean taught me, like, you are doing this not to stress you even more. You are doing this for the opposite, to decrease your stress. So do it while you feel comfortable, pushing yourself a little bit out of the comfort zone, but do it in a way that you don't feel sluggish, you don't feel low energy, because you want to keep doing it. So you need to teach your brain that it brings you good energy, not sluggish, right? So, so I do fasting. I do drink my water without chlorine, and I add apple cider vinegar, and I add electrolytes, and I add mineral salt, like Sean teaches. I enjoy the sun as much as I can because I was in Minnesota, so it wasn't very easy. What else? The strategy. Oh, I do not eat any processed foods. I cut all of it, all of it, all of it. I eat some vegetables. I do. I don't do street carnivore. Sometimes I eat my vegetables. I am working on decreasing them progressively and being more of a carnivore. I love the fermented food. I didn't in the beginning, but I taught my microbiome, and I love the fermented food now. And I do like Sean teaches. Water, fermented food, good quality of meat, good quality of eggs, because again, if you are eating meat that it's extremely marbled, like it's the meat that has myosteatosis, right? And you don't want that, because that meat is a meat that was produced with cortisol. the animals were stressed. The animals were eating grains. So you don't want that because otherwise you are eating their stress, right? And what else? Water, exercise. Oh, I do strength training 3 times a week, and I do my strength training until failure. Um, and I love Pilates. And I do Pilates because I know it's not in the strategies, but I like Pilates because it calms me down. It works in my balance, and it also works with more with my core. And I guess that's it. Anything else that I'm forgetting?
Well, one thing I noticed with your journey on the timeline is you had that period of time when you met Sean and learned about this. And then before you got your first MRI, I know you had other lifestyle changes and stress and things going on too during this period of time that we're discussing here. But when you got that image, and what I want to highlight here is the fact of actually seeing inside your body and seeing what's going on, the value in that.
Yes.
So for you, was that part of the catalyst to finally make the change when you could see what was actually happening in your abdomen?
Yes. Of course, I knew I had lots of visceral fat even before I did the MRI. Because I knew, as a medical doctor, I knew what to look for metabolic disorders. So I had high blood sugar, high insulin, high triglycerides, and high hemoglobin A1C. I knew that my abdomen was my dad's abdomen, right? The abdomen of being pregnant. Hence, lots of people would ask me, "Are you pregnant?" And I would feel so mad. But anyway, whatever. But when I did the MRI and I saw the huge amount of visceral fat, that definitely was a huge impact. Why? Because it's a visual impact. After you see it, you cannot unsee it. You cannot forget. It's there in your brain. You think about it all the time. So that's the difference between the MRI and other like diagnostic imaging or BMI. Like the BMI is the height and the weight, right? Again, normal skinny people would have a normal BMI. Like right now, I have a normal BMI. But I know that if I do an MRI, I am better than the bottom image, but I still have lots of visceral fat or deep subcutaneous fat. So it's like it's deceitful, right? It doesn't discriminate anatomically how much fat I have and what's the quality of the fat. Same for the DEXA scan. The DEXA scan gives you a number, and as a radiologist, I give value to the DEXA scan because the DEXA scan tells me about my bones too, which I want to improve to not have fractures, right? But the DEXA scan gives a general number, like when I started, I was 44% fat in my body. But when you say 44% fat and you are telling me a percentage of visceral fat, that number is a number. I don't keep thinking about, oh yeah, I have 44% of fat. I am 44% of fat. Man, almost half of my body is fat. But when I look at the MRI, I am like, wow, this is a lot. I can see this white all the time. So I believe firmly that, like Sean says, the visual impact, connecting to your sense, connecting to a sense, visual, makes a huge difference in alarming your brain on taking action, you know. And again, the MRI has the benefit, as you can see in the top, both of them, but as you can see in the top image better, the MRI gives me not only the visual, I have lots of visceral fat, severe visceral fat, so quantity, but MRI gives me the quality of the fat. So I can see that I have lots of fat inside of my abdominal cavity. Upper, I could see that I have fat in my chest surrounding my heart. And I also can see the subcutaneous fat, which shows me how much superficial fat I have, which is beneficial and protecting the heart by secreting a substance called adiponectin. But I also see that I have lots of deep subcutaneous fat, which are as damaging to my body as the visceral fat because they secrete the same inflammatory molecules, the cytokines, interleucin 1, 6, tumor necrosis factor, alpha, fibroblasts affect the immune system. So the MRI gives you all this image and this information. And the MRI also gives, because it's the upper abdomen, right? So I'm showing only that image there, but I can see my upper abdomen in the MRI exam. So I'm cutting a little bit of the lower chest, which gives me the information of the fat surrounding the heart. I have the image of my liver, which tells me if I have fat in my liver. I have the image of my pancreas, which tells me how much fat I have in my pancreas. Then I have the image showing all the visceral fat surrounding my organs as an ocean of fat inside of my abdomen. And I have the image telling me the differentiation in the subcutaneous fat. Is it more superficial, good, or is it more deep, subcutaneous fat, really damaging to my body as well? And I can see the amount of muscles I have, if they are getting better, if they still have lots of fat. So I can see all that with the MRI. So quantity and quality, and then the visual connection telling my brain, you got to take action.
Is there a certain path that this fat likes to follow? As you're sharing there, the fact that it can accumulate in muscles, in organs, you got your deep subcutaneous, which is also bad. You have your visceral fat in around the organs. Is there a certain path, like I said, that you can see as a radiologist, as somebody's accumulating this, that it typically goes in through all those different structures, which isn't good? And then the other way around, when somebody like you takes charge and starts to lose it, what's the path in the body that, I should say, order in the body that usually follows as you go through that process?
So this is going to be my own speculation, okay? Because I haven't learned about this before. So that's what I'm observing in my patients and in myself as well. So I would say, and again, my speculation, when I open an exam and it's a thin person, skinny person, thin outside, fat inside, that means the visceral fat starts first, because the person still looks like as if there is no subcutaneous fat, right? So thin outside, fat inside, the visceral fat starts first. And that makes sense because the visceral fat, it's a defense mechanism of your body. You are poisoning yourself daily with, like we said, all these processed foods, chlorine, pesticides, herbicides, plastics, oils, and artificial light. Boom, you are damaging your body in all sides, right? So that overload, that is a huge high carbohydrate intake, and that overloads your liver in the triglycerides, in the glycerol path. And that leads to increasing your blood sugar, increasing your insulin. And we hit the culprit, the increased insulin resistance, right? With the increased insulin resistance, the visceral fat starts accumulating fat in the cells inside of your abdomen, the adipocytes, the fat cells inside of your abdomen. So the first defense mechanism is, wow, I need to be a storage for this fat because it's damaging my body. How am I going to do to keep the homeostasis, which is the body equilibrium? I am going to store this fat in my fat cells. So they increase the volume up to 200 their normal volume, to a point that they realize, I can't increase the volume anymore. So now I'm going to increase the number of the fat cells. So first is hypertrophy, and then is hyperplasia. Then you start increasing the number of the fat cells. While you are doing it, the visceral fat, the cells from the visceral fat, are dealing with increased insulin and increased blood sugar and increased triglycerides in your blood. And then the visceral fat starts secreting the cytokines. The visceral fat secretes cortisol. The visceral fat secretes all the other ones that are molecules that will lead to chronic disease, disruption of your immune system function, normal function, and carcinogens, which lead to cancer, right? So that's a vicious cycle, which in medicine we call the cascade of inflammation. So one feeds the other, that feeds the other, that feeds the other, and it never ends, and it just keeps escalating, right? Exponential poisoning of your body. So again, like you asked me, I would say the high carbohydrate diet, the horrible way we are living right now, leads to increase in glucose, increase in triglycerides, increase in insulin resistance, increase in visceral fat, and then at that time you are thin outside and you become fat inside. Deposition of fat in your liver, which is the fatty liver, and inflammation in your liver, and cirrhosis and liver cancer. Deposition of fat in your brain, which is the amyloid that the deposition starts 10 to 15 years before you develop the whole memory loss, the whole first symptom of memory concern and the dementia. Deposition of fat in your pancreas, diabetes type 2. Deposition of fat surrounding your heart and cardiovascular disorders, and also in the walls of your arteries. Deposition of fat in your pelvis, which leads to urinary incontinence, stool or fecal incontinence, and erectile dysfunction, and pelvic organ prolapse. Decrease in testosterone, increase in bad estrogen, decrease in growth hormone, impairment of your sleep, affecting your melatonin and circadian rhythm, and uh, and that's the fat inside of your abdomen. And then you start putting fat in your subcutaneous soft tissue, the superficial, the deep, and in your muscles, evolving to sarcopenia and frailty of your body. And since all these people are usually going to be sedentary, then you are also losing bone mass.
When somebody learns about what we're talking about today, takes on the strategies, starts to burn this visceral fat, is the body smart in how it preferentially burns the visceral fat versus the subcutaneous fat early on as somebody begins this journey?
I believe so, because again, as you look in my images and what I have seen with some people too, some patients too, clients, is that you can see that my visceral fat inside the abdominal cavity decreased way more than the subcutaneous fat. The subcutaneous fat is still there. Both are bad, right? The deep subcutaneous fat is as bad as the visceral fat. But I believe from what I've seen in me, so now I am analyzing me, okay? I believe from what I've seen in me that the visceral fat goes away first, and then the deep subcutaneous fat and goes away later. I am not the best person to answer you that because I'm following me, but Sean, he has seen different results in his clients. So some people decrease both of them together, and some people, and probably these are the people that deal with less stress, less chronic stress, and some people decrease like me the visceral fat first and then start decreasing the deep subcutaneous fat, which we were discussing the other day, and we don't have a reasoning, but I believe, and he believes too, that might be because of the chronic stress. But either way, when you are doing the strategies, you just have to have patience because you're going to decrease both. And I can attest because you can just look at me.
So far, we've talked a lot about the chemical changes in the body with the visceral fat, the cytokines, the inflammation, and the detriment that does throughout the whole body. What about the actual physical volume of visceral fat in the abdomen with all the organs there and the intestines? Is there anything that we've come up with an understanding of how physically it taking up space there impacts things?
I don't believe that physically it taking up space there would make a difference in the organs, because again, you just keep expanding your abdomen like when you are pregnant, right? You just keep expanding the uterus and you just keep expanding your abdomen. So your body finds a space for everything. I do believe that the damage is the pathophysiology of all the inflammation and all the chronicity and all the release of the substances and altering the function of the cells and altering the function of the immune system and altering like the deposition of damaging substances like the amyloid and the protein in your brain that leads to dementia, the fat in your liver that leads to fatty liver, the fat in your muscles. So yes, I don't believe. And again, when you are increasing your volume, it's just like your life get for you doing your normal life, it's going to get more overwhelming, like because you are carrying all this additional extra weight in you. And then because of the chronic inflammation, your levels of energy, your levels of joy, your levels of like living the full life you are supposed to live just are not really there very much, right?
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
All these problems we are having right now, all of these have been documented that are reversible just by burning your visceral fat. As a radiologist, I see visceral fat in